Well, hello, everybody, and welcome to another episode of our Life West Leadership Line. Today, I probably have a leadership line that I'm excited to do, but I'm also very concerned, not about our leadership line, but something that's been happening in our profession right now that has definitely brought me to a point where I invited these three esteemed doctors on with me from the great north up in Canada, especially up in British Columbia. I've got Dr. Brian Bittle, I've got Dr. Mark Foullong, and I've got Dr. Cameron Allan. So welcome to the Life West Leadership Line, gentlemen.
Thank you.
Thank you.
Thanks, Ron.
And they are on because obviously there's something going on. There's something brewing up in British Columbia that we need to talk about. And that's why I asked to have this conversation, because I've been seeing things and hearing things. And so gentlemen, I'm gonna leave it up to Mark, maybe you first, just to kind of just share what's going on up in BC right now around this X-ray issue that's taking place.
Yeah, well, we've just about a week and a half ago now, we were, our board finished the process of undergoing I guess what I would call a shallow dive into the issue of X-ray, and should chiropractors be taking X-ray, or more so, what should we be taking X-rays for? And so starting about a year and a half ago, they commissioned a rapid review of the literature, which really consists of 9 studies, and came to the conclusion that chiropractors should really only be taking X-rays for red flags. So we would, knowing the extensive literature that is available on this topic, feel like they've ignored, in that rapid review, a substantial amount of research that shows really the benefit of X-ray for the patients, right? For a chiropractor to be able to make a diagnosis, a proper diagnosis, and a proper plan of management, a care plan for a patient. But effectively now in BC, we aren't able to take X-rays for anything but what they call serious red flags.
And how would you say, Brian, what would you say, Dr. Brian, a red flag?
Well, they've ruled it as serious pathology. That's I believe the words they've used. And so, I mean, that's open to some interpretation, I guess. But like, what's a serious pathology? I guess something that you'd expect would be severely detrimental to their health. It's already ongoing. The bottom line is we're not able to take X-rays to assess the spine for biomechanics and subluxation, to be able to see what's happening and how to adjust.
Right. And I want to talk about something, because it's interesting. I want Dr. Cameron to also speak, but it's interesting because when we talk about this assessment, or we talk about a red flag, I was in private practice for 36 years before I stepped into the presidency at Life West. And I saw more things from X-ray that were very serious conditions that I would have never have seen. Let's just talk about aortic aneurysm, right? That you can pick up on an X-ray, or abdominal, aneurysms, I should say. There's things that X-ray pick up that are able to create a red flag that I wouldn't adjust this person, or I wouldn't adjust them in a specific way.
Yeah. Or, and also do that, say like a spondylolisthesis, something like that. So say something that's not as severe, but maybe it would change how you adjust that person. Of course it would. And so that's the difference between that person getting better or maybe getting worse, right? Because, there's the obvious red flags, but there's also those things that even your average clinician would not know, about a patient moving forward. But in that case, if someone presents with, non-complicated low back pain, you're not able to X-ray to see the, nuances of what's going on to be able to provide the appropriate care.
Yeah. And you know what that brings us to, and Dr. Cameron, I'd love you to speak to this. It brings us to, what's the job? Like, what is the responsibility of the board? Or in Canada, it's called the college, obviously, right? The College of Chiropractors in British Columbia, the CB, right? That's
CCC, British Columbia College. Yeah.
Okay, good. So Dr. Cameron, share with us, like, what's the responsibility of the board? If this ruling came from the board, what's the responsibility of it?
Absolutely, yes. That's a very good question. So the way that the structure is set up here is that we do have colleges of chiropractors or colleges of health professions. And so what their role to do is it's not just for policing the profession, but it's also got a range of duties, including all enactments. So for instance, the Motor Vehicle Act, for instance, the Workers' Compensation Act. And so the college's job is actually goes broader than just a policing and regulatory role. To look at that structure further, they have a board of directors. Now, when the board of directors are appointed or elected, and actually in the case of the 8 chiropractors out of the 12, because there's 4 appointed members as well, is that they actually have to take an oath of office. And within that oath, it states that they will act in accordance with the law and the public trust that's placed in them, that they'll uphold the objects of the college and ensure that they are guided by the public interest in the performance of their duties, and they also have a duty to act honestly. And so when they're making these decisions pertaining to chiropractors specifically and public health and safety, they've got to remember that it's not just their professional opinion. They've also got to take into account the other stakeholders, being the public, being the greater profession, the best possible resources available at that time.
Right. And so what I'm hearing is this, and I think it's the same everywhere, right? The board is set up to protect the public.
Absolutely.
And that's a great thing. I mean, obviously, there's people who could be doing things that are illegal. There's people who could be doing things that are detrimental to our public. And so we need to have a regulatory body that can oversee that, right? And obviously, that's a really good thing because it protects our public. The question comes in that I have for the 3 of you doctors is, when does the board start to overstep their responsibilities, right? Here we are, we've got how many colleges? I would say that probably every college, there's one college in Canada, I'm talking about chiropractic institutions in Canada, and there's whatever, 16, 17 college, whatever we have in south of the border, right? We'll say it in the lower 48, right? All these colleges, no matter what they teach, they're taught under the guise of CCE. And as they're taught things, these doctors, graduates as doctors, should be able to go out and use that. When does the board start to meddle in the responsibility of what the colleges are teaching and dictate what the doctors can do, right? And that gets a little bit scary. Is it still in the public interest? And that's the question I want to pose to all of you. Dr. Mark, if you can share your thoughts. We can go around to each of you and just share your thoughts on that.
Yeah, well, that is a great question. To my knowledge of all the chiropractic colleges in Canada and the US and different parts of the world, I don't know of any that don't put, X-ray, like a significant weight on X-ray, teaching their doctors to, take X-rays appropriately to help in the diagnosis and plan of management for their patients, and how to read X-rays and interpret what they find and to use it in the patient's best interest. But I do think, one thing, if you bring up like, where do we cross the line beyond what the scope or the job of the college is, we have to look at why was this done? And, because one thing that we've found out is that there really hasn't been any complaints around inappropriate use of X-ray. And certainly there hasn't been any discipline decisions on it, at least in the last couple of years. So part of what we're asking is were we solving or trying to solve a problem that didn't really exist? Right. And so I do believe that there has been an overstep of really what their mandate is. And we feel, if anything, it's the opposite. If we're trying to govern and regulate the practice of chiropractic in the public's interest, I believe we've actually gone against the public's interest. That we have doctors, chiropractors that are really going into patient care blinded. And it's not healthy for people.
Right. Dr. Brian, what's your feeling on the overstepping or where that line is?
Yeah, I think that the board does have a lot of control. They do have a lot of power, and that comes with great responsibility. And I think that it's important that these guidelines and rules amendments that come down not just be set by, and obviously we can get into, what research was used, what wasn't. Probably what wasn't is the most important, but there's a clinical setting that has to be, that has to be part of this picture, and I think it defies logic that you would say that a chiropractor should not be able to see the spine before they adjust it, when we have the opportunity with relatively little risk whatsoever to be able to see the spine before we adjust it. So I don't care how much research you show me, right? Like there is logic, there is, clinical usefulness of a tool, that of course research is important. Of course we need to prove what we do, but there are innate just tenets that are there that are so powerful to use. And I think it just defies logic that you would say to a chiropractor, it does not make sense to me that you should see the spine before you adjust it. If you feel that there's an appropriate reason to do that. I mean, with the legal team I was talking about, the one guy mentioned, hey, you know what? You can get brought up if you don't take asymptomatic x-rays as a dentist. Like, that's an important part of dental practice, is taking asymptomatic x-rays to determine if there is a problem that could get worse in the future that needs to be addressed now, so that it won't be 10 times the problem that it is now.
Yeah.
Well, how is that different from chiropractic? It shouldn't be. It shouldn't be.
Well, listen, it's part of your law is not, Dr. Cameron, that you are designated, as, primary healthcare, practitioners to hold a level of safety for your patients, correct?
Absolutely, yes. So as a primary contact portal of entry healthcare practitioner, we are mandated by law to make a diagnosis. We are mandated to appropriately diagnose and refer where possible and appropriate. And so with this, it doesn't make sense that they're actually taking away diagnostic ability as opposed to expanding that.
Yeah.
So out of curiosity, it's just like, well, where is this coming from? Why are you doing that? And when you look at the structure, I've been registered in 3 jurisdictions now. And when I came to Canada, I was writing Canadian boards. So you've got these national board exams of which diagnostic imaging is a large part of. And so we're tested on it. And then, if you don't pass those exams, you can't be registered. So if we're tested in it and we're efficient in it, then why are they reducing that capability? It just doesn't make sense.
Yeah, and the British, the British Columbia board, or college is actually, it sounds like, and I'm just making a statement. But it sounds like they're going against what the national board of Canada does. If they're testing on X-ray, they're testing on diagnostic imaging, they're testing on this. It's baffling. I mean, there's a lot that doesn't make sense here. And I'm usually good at, 1 + 1 = 2 or 8, it just doesn't make sense.
So the cherry on top to that is that if you come from a non-accredited, CCE accredited or CCEA, et cetera, accredited school, then you're not actually eligible to register.
Wow. Yeah. Yeah. And the interesting thing too, that kind of comes up is that when you have a body who's regulating how you do what you do, instead of saying where the safety factors are, right? Mm-hmm. I guess maybe I'm missing something here, but and Dr. Brian, you talked about this, like dentists. I mean, they need to take pictures of teeth, right? X-rays to be able to see what's going on, or cone beam, whatever they're using. But with chiropractors, and we're supposed to be able to take the patient's safety, as paramount, yet they're taking one arm and they're putting it behind our back, tying it behind your back, where now you just lost another diagnostic, way of not just looking at the patient's health and safety, but also what you're going to do with them. Mm-hmm. And that's critical.
What really strikes my heart about this whole thing is that, I want to have a conversation with my patients and have us be able to choose, between me and them, and have all the resources and the best tools available to be able to have this conversation with that patient and be able to provide them with the best outcome they could possibly get. Yes. Because we have made that decision together. But unfortunately, what this puts me in the position of is I'm wondering, while I'm going through that new patient consultation, oh, is this a situation where I can or can't take an X-ray? And it's taking our focus away from what's best for that person. And that's what I want. I want what's best for my patient, and for our patients to get the best quality, the best possible care that they absolutely could. And I believe that this decision is taking away from that, because it's taking away from the doctor and the patient, and most importantly, the patient be able to decide what is the route that they want to go to take care of the problem that they have. Right? Or what's the route they want to go to prevent problems in the future, and to be able to take care of their bodies in the best way. That's a conversation a dentist and their patient have about what X-rays they want to take in order to provide the best care going forward.
Yeah. Yeah. And you know what they're doing, to be honest with you, and I'm just Dr. Cameron, 1 second, they're minimizing the education.
Yeah.
They really are. I mean, they're basically saying everything you got taught in school, what we're testing you on the boards, the Canadian boards, you can't use that here. And I get you could use it if I send you out for an X-ray or I do whatever, and I don't even know if that's legal. Is it? You can't even send someone out for an X-ray.
It's affecting X-rays we order as well.
Yeah. Wow. That's
just
scary.
To speak to that, in 2010, 2011, the College of Physicians and Surgeons actually put out to their registrants to actively not accept referrals from chiropractors.
I thought we were beyond those days. Mm-hmm. We go back to the Wilkes trial that took place in the States, right? With the AMA, and and you look at what took place over that in the 70s and how we won that. And I thought we were way beyond that. But the sad thing for me is that we have a regulatory body that is not necessarily doing what they're set out to do. And I'm not saying they aren't, but it just sounds like it. It just sounds like if it's in the best interest of a patient, that a doctor, a licensed doctor, a doctor of chiropractic would know what's right for their patients. And, you went through this rigorous education, you went through your rigorous board examinations, and you've done everything. And this is one area. This is BC. But that's not going on in Ontario. Well, how does, it's just baffling, this should be more of a national issue, right? And it just seems like you're being targeted. And when you look at that, it comes out, on some level, we have to admit that we've got a diversity and inclusion problem going on here, right? Obviously we've got diversity in how we do technique. We've got diversity in how chiropractors are trained. Nothing wrong. They could be coming from Life West. They can be coming from Life University. They can be coming from Southern California. They can be coming from Canadian Memorial College. And they might have different training in all these schools, but it doesn't differentiate. It doesn't say that you have to do it like this. You could still have that right to practice how you choose to practice, right? On a diverse level, right? And be included.
Yeah, exactly. I think too, really important. I'm glad you brought that up, because we have diversity of technique. We have diversity of training. And diversity even of managing a patient's care from start to finish. And the beauty of it is that diversity, I believe, is the strength in chiropractic. It gives, and especially it's in the patient's interest to have a choice, right? To have a choice. And for a chiropractor to be able to refer to another chiropractor. That's what we should be doing, because they specialize in the upper cervical spine, or because they specialize in spinal correction, or because they can get someone, to feel like $1 million in a couple of weeks, whatever it is. That diversity is the strength of the profession. And we feel it's really, it takes away from the patients to take that choice away from them.
Yeah. Yeah. And the management, correct?
Yes.
You're taking care of somebody and, you're not getting the results that you'd like to see. You might not x-ray someone at the very beginning, but you want to be able to use that as a tool, right? If you're not getting the results, that you can refer them out or possibly take them in your office, whatever it is. And it totally takes, it's tying, it's definitely tying your hands behind you. Yep. Dr. Cameron.
On that interest as well of diversity and inclusion, something that I was just baffled to see is that they did not include specialists like DACBAs, medical radiologists, the College of Radiology in Canada or the US. And they've requested one group do a rapid review. And again, we're not sure why it was a rapid review and not a more deeper dive. and they don't seem to be engaging the specialists in this area. And just to quote a couple of them, Marshall Deltoff, you don't know what you're missing.
Yeah. Yeah, and I'm happy to listen. I'm happy to change my view on this at any time, but I was taught, and I could be wrong, and I'm willing to be wrong, but I was taught that rapid reviews are done during epidemics. They're done during emergency situational times. That I'm not talking about COVID, but they were done during emergency situational times where you need to get information right away. And to me, a rapid review of how many articles that they boil down to whatever, I think Dr. Brian, you said at the very beginning, 9 articles or whatever it was, whatever it was. It just doesn't make sense. I don't know. Once again, there's a lot of things that just don't seem to be making sense to me. And I might not be the most sensible person in the world. And I'm the first one to admit it. My wife will certainly tell you that also. But I think that we really got to look and see, how do we make changes, and I think one of the things is your board. How do people go? I'm curious. I'm an American, how are your people put on the board? Can you share that with me?
Yeah, well, it's the 8 chiropractors in BC, because every board is a little bit different. Every college is different. So the 8 chiropractors are elected by their peers, right? In BC, there's different regions, and the peers in that region pick who their elected representatives are. And then there are 4 appointed members that are government appointed. So we actually have a say of 2/3 of our board. But here, I think, is the problem, Ron, is that a lot of chiropractors not only don't participate and run for board positions, because that's not something everyone can do, but just don't maybe take the time to figure out who's running. What do they stand for? Do they support the diversity of the profession that gives it strength? Are they going to represent the public well? In governing the profession, right? Or they just have they just want to put on a police hat and belt and police the profession. So I think it's really important, and I think this is everywhere, but especially here in BC, obviously we feel the burden that let's just get out and find out, figure out who's running, who's there to represent you, who has already made decisions that we're now living with the consequences of, and who do we want to make decisions for us going forward. I think that's really important. We still have such a low percentage of chiropractors actually voting for our elected representatives, and that's really unfortunate. We need to get active and involved.
Right. And I believe this is going to happen now, obviously, right? Sometimes, unfortunately, as chiropractors, we get so involved in our practices, right? Because we're servants, right? We're public servants. We kind of forget this, but when something like this comes up, next thing you know, there's going to be a lot of people who want to make changes, obviously, right? Hopefully. Dr. Bittle, Dr. Brian, let me ask you a question. When we're talking about the board and we're talking about, the makeup of the board and getting out, right now, what are you guys doing, in BC? What are the doctors doing right now around this new law? And what can we do as chiropractors, whether in the States, whether we're in the other provinces that aren't being affected by us? What can we do to help support this issue about public safety, patient safety, making sure doctors have the right tools that they need to be able to give the best quality care they can possibly give? What's out there for us to do?
So the first most obvious thing is, I guess, by the time this is aired, we'll probably have filed an injunction with the courts to get this amendment paused. It doesn't mean the problem's over. It just means it's paused. And that's a big if too, that injunction. But we're confident that with the research we presented and all the things, the professionals and the experts that we're putting together, a research team that we put together to kind of battle this, that injunction will be successful. And that'll give us a pause. But we've got a legal bill that's going to be substantial. Obviously, that would be the gratitude around helping us out here would be infinite.
Right, and that would be donations, and that would be people, and I think that people need to understand that it's not just BC.
And just so you know, we're doing our part here in BC. We've stepped up. We've got a group of docs together to really support each other and get this going in the direction that it needs to be. But we are a small group compared to what's up against us. And so we would really appreciate that. I guess another thing would be just showing support, showing support, maybe writing to college and just saying, British Columbia College of Chiropractors, and saying, hey, you know what, like, this doesn't make sense to me. If they get thousands of letters like that from chiropractors saying, like, what about this? What about the doctor-patient, conversation that they have? Like, shouldn't this be a part of this decision-making? What about all the research that got ignored, or seemingly ignored in this process? What about the top, DAC bar radiologist chiropractors who would disagree with this decision? Why aren't they being talked to? So letters writing in, I think that would help a lot. And so those would be the two big ones. And those letters being written in, I would love it if the focus could always be, hey, you know what? This isn't what's best for our patients.
Yeah.
Right? This isn't what's best for our patients. So, but we would love that support.
Yeah. And it's really what it's about. I think that we need to be really clear on something. And thank you for sharing that. And can it be chiropractors from the States writing these letters and all over Canada? It doesn't necessarily have to be BC, correct? And same thing with donations. And I'm going to encourage, all of our viewers, we'll have a link up where you can, donate to this, because legal funds cost a lot of money. And unfortunately, if that's how you have to make the change, then this is the direction it needs to go in. And I know that the National Association is doing things there, but I think the other point that we need to make clear is that the board isn't bad. It's not like an us versus them or anything like this. The boards are all set up, and they're good people who are meant to do good things, right? And sometimes, what our actions aren't necessarily the right actions, and that's okay. It can be changed. It's not like they're out there trying to hurt somebody intentionally. And that's a wrong picture to paint. What it is to say, let's take a look at this. Let's have an open discourse. And Brian, from what I'm hearing you said, and let's look at the research and move forward, right? Mm-hmm. Dr. Cameron, we're going to have to wrap this up, guys. But Dr. Cameron, you've been so patient and so quiet there. Anything else you want to add to this?
One thing I'd like to say pertaining to patient and public safety. Luckily, I'm a second-generation chiropractor, and I remember 15 years old attending a pediatric symposium with my father and meeting the late, great Lindsay Rowe. Now, Lindsay's was a very well respected individual and radiologist, both in the chiropractic and medical field. And I'll never forget this, 15. He says to my dad, Rob, if you're manually adjusting somebody and you're not taking a film beforehand, then playing with fire. And, if I look at the last 10 or 20 films that we've taken in both of our offices, the things that we've caught out of area that have needed immediate medical referral for our colleagues over in the medical realm to follow up on, it's probably 8 out of 10 of them. Yeah. And so there's stuff that we're catching on film that we wouldn't otherwise. And so for me, we've got to be there for our patients, we've got to be there for the public, and we've got to do what's right. Yeah, and I just want to share this as we wrap up. I trust that the board, the college, will do what's right. Mm-hmm. I trust it. I think that there just has to hear the voice, hear the people, the doctors, hear the patients. Also, I think Dr. Bittle, Brian, that patients should be writing in also, right? I mean, everybody should be expressing their views. And I trust they will do the right thing, because if they're really here for the right reason, which I believe they are, that they will do the right thing. And that is to, return the right, the diagnostic right for chiropractic x-rays. And I just want to thank the three of you, and I know there's more, but the three of you for standing up, for stepping up, Dr. Cameron Allan, Dr. Brian Bittle, and Dr. Mark Foullong for joining me at this time, at this very sensitive topic that's going on, in British Columbia. And that I want to encourage every doctor that's listening to this and watching this to join in, help Canada, help British Columbia, and let's make a difference in what's going on so that we can be able to donate money, write letters, do whatever it takes, but let's do this so that these doctors and the patients, especially, because it's really who it's for, do not feel alone. This is not a British Columbia issue. This is a chiropractic issue. And let's stand up as chiropractors and make a difference. And I want to thank the three of you for being with me today. As my lights just went a little bit dim, it's kind of that time for me to be able to say that thank you. Huh? You saw that. I can just go over here and all of a sudden my lights come back on. But I want to thank you guys for stepping up,
and for being here, and thank all of our listeners for being with us at the LifeWest Leadership Line. We'll keep coming at you with different leaders, but also important topics, because this is a very important topic. So please take it serious and help our Canadians all over Canada, from whether you're in Canada or outside of Canada. It really doesn't matter, because we have people from Europe who are watching this, and all over the world, actually. And there'll be a link at the bottom, help donate and send letters and do that. Be respectful, be polite, and let's really work with each other along with the boards to make a difference. So thanks so much. Until our next Leadership Line, I'll be coming at you. Remember to stay in that bubble of love and keep sharing and spreading the word of chiropractic and taking care of people the best that you know how. Okay. Talk to you next time. Thank you, gentlemen, for being with us today.
Thanks,
Ron. Appreciate it.